This is a 36-year-old female. She presented to my office with a chief complaint of migraine headache and upper back and neck tightness and soreness. Now, when we take a look at this, let me just bring up the pre. So this is her prefrontal right here. We can see that this is a left contra atlas. Our acute angle is here for the skull and atlas frontal plane line. The acute angle on the opposite side, on the right side, for the cervical spine in relation to the atlas frontal plane line. So acute here, acute there. We have a contra, which lets us know how to adjust this atlas. The one thing I want to show you on this is down here, I measured out the discrepancy in her shoulder height. So we have about almost a 27 millimeter drop on that right shoulder in her normal posture. This is not standing posture. This is seated. So this is seated, correct posture. This is her normal shoulder drop, and she did confirm that with me afterwards, after I saw this, that yes, she does realize she has a shoulder drop on that right side. So let's bring up the pre and post. This is after one adjustment. Pre is on the left, post is on the right. So on the right, we can see that when we're looking at the actual atlas orthogonal lines for the adjustment itself, they're about the same. But what we're looking at as far as change goes is from here, we have a 26 millimeter drop on the right shoulder down to about a 3 millimeter drop. This is after one adjustment. Quite a profound difference. So what we're seeing is through that one atlas adjustment, that one atlas orthogonal adjustment, a incredible, significant change to the postural muscles. The one other thing I'm going to show you in addition to that is if we follow here, the thoracic spine down, we can see that yes, she has a lateral curve on that thoracic spine, pulling to the right side. After a single adjustment, you can see already that thoracic spine is straightening out on us. It's one adjustment with the atlas orthogonal technique done properly. Incredible. So why does this happen? How did that happen? Let's take a look. So when we are looking at, I want to show you a little bit of anatomy here. When we're looking at the anatomy up here in the upper cervical spine. So what I did is I pulled this up right here. So if you follow the mouse pointer here, you have the jugular vein, you have the carotid artery right back and through here. There's a lot of nerves that come down through here as well. Now this also, kind of this translucent effect right through here, this is what's called the carotid sheath. So the carotid sheath is a sleeve that houses the jugular vein, the carotid artery, and a handful of nerves. I'm going to get to those nerves in just a second here. If we take another look, by the way, I just want you to pay attention to our proximity to the upper cervical spine with this group of arteries, veins, and nerves. If we take a look at this is our upper cervical spine anatomy. This is just the jugular vein coming down through here, but if we look at the atlas, C1, this is the transverse process of C1. That jugular vein hugs the transverse process of atlas. Now, don't forget, it's not just the jugular vein. It's the jugular, it's the carotid, and it's a handful of nerves, cranial nerves. Very, very important. It is literally making contact with that transverse process of C1. I also want to point out the styloid process up here. If we have Eagle's syndrome, if we have elongated styloid processes, this can become even more of a problem for us. Let's move on to the next picture I'd like to show you. This is we're kind of looking, inferior to superior. This is the occiput, right back through here. The base of the occiput, we're looking up at it. This is the mandible, right through there. This is the hyoid right there. So the hyoid looks huge just because of the way we're looking at it. But again, right here is your atlas. There's your C1 bone right there. There's the transverse process of C1. Here's your carotid. Here's your jugular. The vein that they have, or I'm sorry, the nerve that they have here, diagram, and actually in the diagram here is your vagus nerve. So, by the way, for those of you interested in vagus nerve, because I see this stuff, especially on social media. How do we activate? How do we activate the vagus nerve to get our bodies to relax? Well, it is not a woo-woo thing. There is really some physiology here and some anatomy here that's important. That vagus nerve is within the carotid sheath. So let's take a look at that carotid sheath anatomy and see exactly what's on the inside, but while keeping in mind the fact that all of this is nestled against the transverse process of T1, or C1, I'm sorry. We have, here we go. This is a cross-section of that, the carotid sheath. So here is the cross-section of your carotid artery, cross-section of your jugular vein. Here are your cranial nerves right through there. Okay, so we have the vagus nerve is in here. We have cranial nerve 11. This is really what I want to talk about. I don't want to focus on the vagus nerve, even though that's important. And as upper cervical docs, by the way, you are going to have people come into your practice who want their vagus nerve to be active so that their bodies can calm down. People know about this. They are doing research on it, and they are desperate to get that vagus nerve to calm down. And imagine if you have mechanical pressure on that nerve, what it's going to do to a human body. It's tough. But let's focus on, for the sake of our example today, let's focus on cranial nerve 11. So the cranial nerve 11 is our spinal accessory nerve. Function. Cranial nerve 11, the spinal accessory nerve, is a motor nerve that primarily controls motor, right? So we're affecting muscle tissue, that primarily controls the sternocleidomastoid and trapezius muscles for shoulder elevation and head retraction. So shoulder elevation is what we're focused on. So going back to this example here, this is an atlas subluxation. The atlas does not move it does not just go straight lateral, it does not just go straight rotation. It's like a saucer in a dish, okay? It rotates with laterality. So if we have a left lateral atlas, it is also rotating. When that rotates, that transverse process is going to make contact with the carotid sheath, and it's going to affect not only your vascular supply, your blood supply to your brain, and drainage of the blood from your brain. Again, upper cervical docs, you are going to have people come in that say they feel like there's just tons of pressure in their head or in their brain. And there is, because it can't drain out. The jugular is not draining. The lymph system is not draining. They have head fog. They can't think because they're not getting blood supply to their brain. They can't relax. They have anxiety. They have insomnia. They have depression. They have gut problems going to the vagus nerve. But in this situation, we have somebody whose physiological presentation is showing us almost a 27 millimeter shoulder drop. We have to pay attention to that, and especially after one single atlas adjustment, it comes up to near level, virtually level. That is proof of a C1 subluxation, atlas subluxation, pressing on the carotid sheath, irritating the spinal accessory nerve. And it was corrected instantly. I love this stuff. It's amazing.